So, welcome everyone. You are starting your journey into the language of medicine. This isn't just a course about memorizing flashcards, it's about learning to decode a language that allows you to communicate safely and accurately in a clinical environment. So, by the end of this chapter, you should be able to recite rules, look at a complex medical term and break it down into its core parts. Let's go back to this. So, why does this matter? You can think of medical terminology as a safety net of healthcare. When you walk into a hospital, you are entering a world of standardized communication. If a physician writes an order and it is misread due to lack of understanding, the patient is at risk. Mastering these medical terms is your first step toward ensuring patient safety, streamlining documentation, and delivering accurate quality care. So, this is just a really brief video regarding the roots of most medical terms, which are Greek and Latin, primarily Latin. And you can watch that on your own. Okay. So, let's start with the skeleton root words. You want to think about the root as the DNA of the term. It provides the central meaning. For example, if you see lith, you immediately know we are talking about a stone. Practice these roots like you would a second language. Internalize their core concepts first and then build around them. So you will see these knowledge checks throughout the chapters. The answers can be found in the note section. So check your understanding and then also check your answer by looking at the note section. So, how do we connect these parts? That's where combining vowels come in, the O, and you'll see a slash in front of it. Why the O? It's entirely about phonetics. It makes the word roll off the tongue during high stress, fast paced environments like the clinical setting. So these are just some common uses of the combining form. You have in cardio, gastro, osteo, chole, and you see an exception, E versus an O, but it's typically an O. So, some rules if you're ever unsure, remember if the suffix starts with a consonant, keep the vowel. If it starts with a vowel, drop it. It's all about creating that natural flow. Prefixes are your directionals and modifiers. They tell us how, when, or where. Think of prefixes as the adjectives of medical language. When you see anti or hyper, they are setting the stage for what the root word is doing. Master these, and you can change the meaning of a base term instantly. So, for instance, when you put this A in front of febrile, it makes it without fever. So, practice these, and you'll get a lot of practice in the book. So, most prefixes end with a vowel. However, there are some notable exceptions. So, an means not, post means after, sin means with or together, and ab means away. So here's another knowledge check for you. Take your time, answer it. Try to answer it without looking at the answer in the notes and test your knowledge. So suffixes are usually the what of the situation. Are we talking about inflammation, itis, a study of something, logi, a preoccupation or condition, mania? Suffixes complete the thought. When you approach a new word, look at the end first. The suffix tells you if you are looking at a diagnosis, a procedure, or a biological process or condition. So here's another knowledge check for you. And throughout all the chapters, there will be time for a brain break. This is important not only when you're taking in the chapters, but also when you're studying. Learning science has shown that we really only can study for 20 to 30 minutes, and then our brain needs a break. This revitalizes your brain and then puts you at a higher effectiveness for studying or taking in knowledge. So, when we're putting this all together, you can see some examples here. So, hypo, which means under, is connected to the root word calce and calci, and then the suffix emia, which means blood condition. When you put this all together, it becomes hypocalcemia, which is a decreased calcium in the blood. Another example is putting peri, which means around the prefix, with the root word articula with the suffix ar pertaining to. And then you have periarticular pertaining to the area around the joint. You'll get practice doing this throughout the week, and then you'll also get some practice during your discussion question as well. Sure. So let's talk about some other words. Not everything follows the neat rules of Greek and Latin roots. We have eponyms. These are usually disorders that are named after people, as well as abbreviations. So these are the jargon of the medical field in practice. You will use these daily, like cabbage or SOB, but be careful. Always ensure your audience understands the specific shorthand you are using. We're also going to continue that as a theme throughout our course because I want you to be able to decipher these words and put them in lay language for our customers and clients. So, this is the part that trips most students up. So, you want to memorize these patterns. It's not just adding an S or an ES. You'll need to commit these to memory in some ways because you will see these variations constantly in pathology and anatomy reports. You could possibly keep a cheat sheet handy, but with usage, you will get more comfortable with the terms. So, why spend time on pronunciation? Well, there are a lot of apps now, and even your book has a way for you to go into any term and have someone pronounce it correctly for you. One of the tricks that I use is a phonetic spelling to help me to understand how to pronounce these sometimes difficult and long words. So, because confidence in speaking leads to confidence in usage, practicing these words also helps. Use these guides that are provided in your book, as well as a notebook tool that I have for you. And hearing yourself say it correctly will help you build confidence and anchor it in your memory. So these are just some additional rules. Um, These also feature in your online Evolve platform, once again, that pronounces all terms and words for you. This provides you with the opportunity to listen to the correct pronunciation and then repeat it. More rules. Okay. So, and then we have a knowledge check for you. And once again, try to phonetically spell your words out, which gives you a guide of how to pronounce them. So you have now completed chapter 1. Use these references to cross-reference terms that you encounter. Also, week 1 content is the foundation. Everything else you learn during the course will build directly on these rules. Good luck and keep practicing.